Hi everybody, and welcome back to my channel. Chronic pain stinks, and it does. um, I'm making a video on how winter and chronic pain, how winter affects chronic pain. First, I want to say that my channel, I put some facts and a lot of personal experience. I've had 2 failed back surgeries, so I have a lot of back pain. I see a pain specialist, and I've been suffering with chronic pain since 2007. And I expect to suffer from it for the rest of my life. And it's not a pleasant thing to think about. But if I can help just like one person in these videos, that's why I'm making them. Plus, I can look back on these, and my children can look back on these and maybe understand their mom a little better. Or maybe I can understand chronic pain a little better on bad days. Okay, so today's topic is winter and chronic pain. I say that because I live in Wyoming, so it's kind of near and dear to my heart, because winter causes me so much more pain than other months. So, first of all, I would like to define how the dictionary defines winter. Winter is the coldest season of the year in the northern hemisphere. And that's from December to February, is what they say. Now in Wyoming, we can get it from September to March, or now we're in September and we're still in 80, 90 degree temperatures. It depends year to year where I live. And in the southern hemisphere, it's from June to August. That's for our people across the lake there on the other side of the world. So, now the definition of pain. The definition of pain, per the dictionary, is physical suffering or discomfort caused by illness or injury. Now, my chronic pain came from a back surgery. 2 failed back surgeries. So, chronic pain can be really from a lot of different sources. Chronic pain is defined as persistent pain that lasts weeks, years, or possibly a lifetime like mine. And that's not something I like to think about, but it's true. I mean, it's the facts, and the facts is what's important here. I know my channel doesn't reach very many people. I have 47 subscribers, and I love it. And please, smash that like button, share my videos. If we share the videos, then the videos can get out there, and maybe I can get on some kind of algorithm. I can't even talk. Okay, back to chronic pain. Okay, chronic pain is worse in the winter due to a number of factors. Now, I've put down 2 or 3. I don't want this to be a long video because I don't like my videos to be long, because then people lose their attention, and then you've probably pretty much lost your audience. And I only have 47 people, but I appreciate all 47 of you. I wish you would leave comments for me so we could communicate back and forth. It would be so nice to communicate to other people that have chronic pain, so that I can get an idea maybe of what you're really looking for. Because I've decided that doing this helps me, and it also helps fill my time, because I can't work. And that's, being a homebody is nothing I ever dreamed I would be. I had a career. I was on the move. I was on the move up the ladder within my company. I was in management. I worked hard to get there. I worked for a company that it was hard. They didn't really like to promote a lot within, so it was hard. But I made it, and I was a manager, and I was on my way up the ladder, and I ended up having 2 back surgeries. And both surgeries, boy, they're going to fix it. The first one, they're going to fix it. The second one is, oops, it didn't fix it, so we'll go in and fix what we messed up. So I have all kinds of hardware in my back, and it's very difficult in the winter, especially living in a cold climate. Okay, let's get back to some of the factors of why winter can cause chronic pain to be worse. Okay, one is the barometric pressure. As the weather gets colder, the barometric pressure will drop, and that can cause your joints and ligaments to swell and lead to pain. There is a lot of truth in what they call being a snowbird and why they're snowbirds. I used to laugh at that definition, but there's a lot of truth to it. Sorry, I had to have a drink. There's a lot of truth to why people are snowbirds. And if I could afford to be a snowbird, I would be one. Okay, the temperature. Cold temperatures can make chronic pain worse, especially for people with conditions that have like arthritis, fibromyalgia. That's a big one. And I firmly believe that fibromyalgia is a thing no matter what controversies out there about it. It also can affect autoimmune disorders. I also have an autoimmune disorder that is weather affected. It's mostly the hot weather that would bother me. As much as I love the warmer climate and the hotter weather, it's the hot weather that bothers me. As far as a lot of physical issues. Then in the winter, it's the pain. I have pain all the time, but it just gets worse in the winter. And I gear up for it. I get used to it. You have to when you live with it. You know, it's different when you live in a condition or with a condition that can cause pain, because nobody likes pain. I don't know anybody that would come and say, oh, I like to be in pain. Yeah, I like that. No, maybe when you were a teenager, sometimes you could cause yourself pain and it would take away the emotional pain. But I'm talking about just living life every day with no problems, but being in pain. And it's hard. It's very, very hard. Okay, so the cold temperatures make it worse. And that's a fact. And especially for conditions that are like arthritis, fibromyalgia, or a lot of other autoimmune disorders that can cause pain. Now, one of the other reasons is synovial fluid. Now, this is fluid that your body supplies your joints to keep them lubricated so that you can move your elbows, so you can move your knees. As you get older, that becomes thinner and it gets harder to move those joints. But in the winter, that fluid doesn't lubricate as well because it gets thicker in the colder weather. So if you've ever had a pain condition and you're like comfortable inside in your house, you have your house at a comfortable temperature, and you step outside into the cold, you stiffen up. And that's because this fluid gets cold and it doesn't lubricate those joints as well. So the elbows don't move as well, the knees don't move as well, your back doesn't move as well, your neck doesn't move as well. The body is really funny. I mean, it can melt down maybe like an ice cube can melt down if everything doesn't work in order. And I figured that out when I dug into all the medical things behind chronic pain. And when I decided I wanted to make a channel, because if I can help you, or maybe your friend, or somebody you know that you can pass the video on, then I've done my job. I just want to help one person if I can. I would love to help more than one person. I would like to have a network and, where we could communicate. But all I can do is start with my little channel and hope that somehow or another people share it. Like there's 47 of you out there right now. And if all 47 of you would watch this video and you would share it, I could probably pick up more subscribers and we could do this a little bit more often. Another reason that affects chronic pain in colder climates is the humidity. When you have changes in humidity, it can make your joints swell, and then you feel they're more painful. If you have inflammation in your joints, then of course it's more painful. That's why a lot of doctors will prescribe you an anti-inflammatory. I have been on anti-inflammatories. They don't really agree much with my stomach. Ibuprofen works best for me, so on those bad particular days when I know it has something to do with like the joint swelling or, nothing serious other than just minor situations that the ibuprofen can handle, I take the ibuprofen. I would much prefer just to take ibuprofen instead of the pain meds. I do take pain meds, and there's nothing wrong with taking pain meds. If your doctor prescribes you pain meds and you take them as your doctor asks you to, and you don't abuse them, there's nothing wrong with taking pain meds, no matter the stigma behind it. Okay, in the wintertime, you have decreased activity. So in your warmer climate, you may get outside and you may walk around the yard. You may look at your flowers. I have lilac bushes that I trim and cut back, and I have beautiful tulips that come up in the spring, and I always am tending to them. I'm outside a lot when the weather gets warm in the spring. But in the winter, I'm inside. And I'm primarily inside. There may be a week that I don't even go outside. And it doesn't really bother me any. My husband used to think I was going to end up depressed or whatever, and a lot of people in chronic pain do suffer from depression and anxiety. Now, I do have anxiety, and it was being treated, but the pain doctor said either treat the pain or treat the anxiety. So I had to choose to treat the pain because that's the worser of the two evils. So I do deal with anxiety attacks, and that's kind of part of it. That's for another video, though. The decrease in your activity, because you're not using those joints as often, can cause them to get stiff or to, not really want to work as well as what you want them to. It can cause stiffness and fatigue. That's why, you hear of a lot of people, if they can straighten their arm out and their elbow will pop. Or they lean forward and their back will pop. It's because you're not getting the exercise that you would normally get and that your body is used to. So when you're just kind of sitting around in the house watching TV, reading a book, trying to stay active, a lot of times we keep our mind active by doing things like reading a book or crocheting or watching TV. We don't really get up and do any physical exercise. Sure, I'm not taking anything away from cleaning your house and taking care of your house, because that is exercise and it is activity. But it's not the kind of activity that you would normally have in a warmer climate where you're in and out and able to go outside and walk around and enjoy being outside. And chronic pain in the winter in a colder climate can cause other psychological issues like SAD. That's for another video, but they have proven that a lot of depression and anxiety goes with chronic pain because of just that. You're active in the summertime. You're active and you're outside. You're walking around. You're doing all of the things. Winter comes along, and also all of a sudden those things are like poof, gone. So it's very important, especially if you live in a colder climate, my glasses have a glare. It's very important to exercise, or remember when that I'm trying to think of the name of it. It's a little dance skit. I think it was called Get Up. And it's a very cute song. You might want to, Google that. It's called Get Up, G-I-T, space, up. And it's a cute little song, and you can dance to it, and you can do it right in your bedroom where nobody's watching, and just kind of enjoy yourself for a minute, and it keeps your joints going. I mean, doing little things like that several times a day, taking a break from your routine, getting up and stretching, even walking around your house. Depending on how big your house is, you can probably make laps around your living room or your dining room and living room, and your family will understand, because they understand you. That's another one, is families dealing with chronic pain, and that's again for another video. I want to kind of wrap this up because we're getting close to the 15-minute mark, but I do have a few tips for dealing with chronic pain in the winter. One is dressing warmly and dress in layers if you can. Like especially in my climate, it can be really cold at night or in the early morning. But if you have like a sweater, shirt on, a long sleeve shirt like I have today, and then a sweater, and then maybe, you're like maybe a one of those balloon vests they see, and then a coat. You can take your coat off, you can take your vest off, you can take your sweater off, so you don't get overheated in the house. But then you can dress with the appropriate amount of outer clothes to keep your joints and everything warm when you walk outside. So dressing warmly and in layers is very important. It's not a joke like we used to think when we would hear it all the time. Dress in layers, dress in layers. I used to always wonder, what the heck? I'm not going to layer on shirts or things like that, but it does make sense. The other thing is if you install a humidifier, if you live in a dry climate like I do in Wyoming, having a little bit of moisture in a dry house does help. Or if you live in a very humid climate, like, I don't know, Missouri's very humid. I know that because I used to live there. Kansas is very humid. You could, you can use a dehumidifier, and that takes a lot of the moisture out of the house, which then also, creates that even balance for the pain. But the most important thing, the very most important thing that I can recommend for anybody with chronic pain is to stay hydrated. Every time you pass that kitchen sink, take a drink. Have your cup there, that's your cup, and every time you go by, take a drink. Fill your water bottle. Everybody's into these water bottles lately. Fill your bottle with water. So that when you're making your lap around the house, you can take a drink. When you decide to sit down and watch some TV, take it with you. You have a drink. But water is very important. So often, especially me, I get hooked on drinking the pop. I get stuck on drinking the Pepsi, Diet Pepsi. I haven't had any problems with it, but I forget to drink the water. And water is very important for your body and your joints. Staying hydrated really does help chronic pain. Okay, I'm going to sign off, and I'm thinking of a little, I don't know, funny little saying that we can say when we sign off, and I think what it's going to be is stay active. See you on the next one. Bye.